How did the pandemic affect the public health system? In this blog, we are going to talk about the consequences of the coronavirus, how it affected our world reality, and what that we were used to do. As we know, the arrival of the pandemic in 2020 brought with it many catastrophic consequences. It became a global public health crisis. In Mexico alone, between 2020 and 2021, a total of 15 million deaths were recorded, which according to the OMS represents an excess of mortality. The consequences range from increased poverty, decreased access to basic resources, shortage of medicines, and even social isolation. Human resources were affected. Also, it changes all the regular actions in hospital. The pandemic had an impact all over the world. All humans had to adapt to this new modality, in which we had to give up our daily activities, live with other people, even stop attending school in person. Not all countries were prepared to face this reality.
Today we meet with the nurse Sandra Garcia, who will give us information and her opinion based on her experience with the pandemic.
How did the pandemic affect the public health system?
Bueno, fue un impacto muy considerable en el que se perdió muchas vidas humanas y que aún con todo lo que se realizó, las medidas que se hicieron, pues no se logró detener el número de casos, ¿no? de la enfermedad, puesto que esto era un virus que en cada persona pues siempre se comportó diferente, ¿no? En unas personas se presentaba de una manera y otras de otras, entonces eso no permitía que tú dijeras, es para, este medicamento es para esto, ¿no? Entonces hubo un descontrol que pues no se pudo delimitar.
Okay.
Pues vimos que pues por todos lados había muchas situaciones, ¿no? que se salieron de control.
Okay. Who do you think they were the most affected in terms of these diseases?
Hubo el grupo de personas adultas de enfermedades, bueno, que tenían padecimientos ya agregados, como los diabéticos, los hipertensos, los obesos. En ese grupo de personas, bueno, creo que yo vi que eran los más afectados, aunque hubo una cantidad de adultos mayores, pero no era tan elevada. En cuestiones también jóvenes, menores de 30 años, que también no se logró o no se sabe por qué a ellos los atacaron, ¿no? Si no tenían algunas enfermedades agregadas. Entonces, pues sí, o sea, ahora sí que atacó a toda la población, pero sí específico, en mi caso yo vi que fueron más adultos entre, no sé, te puedo decir una cifra de 35 a 50 años.
Okay.
Sí, más o menos.
How did your work change with the arrival of the disease?
Bueno, el trabajo, pues yo creo que pues fue un descontrol total, ¿no? Un descontrol que una enfermedad nueva, no sabías cómo actuar, cómo protegerte, tanto a ti como a las personas, o sea, sí, pues prácticamente un descontrol. Los médicos no sabían cómo actuar, aunque nos llegaban actualizaciones de cómo actuar, cómo protegernos, qué hacer, qué esto. O sea, el estar ahí es una situación difícil y que tú ves que la gente afuera no se cuida. te entra una desesperación, porque pues en el momento que tú estás ahí no puedes ya hacer nada, o sea, porque ya eran personas que llegaban prácticamente pues a morir, a descender.
How did this event impact in your daily life?
Pues mi vida, pues volvemos a lo mismo, ¿no? O sea, te encuentras en una situación en la que no sabes qué hacer, ¿no? Porque por una parte está tu trabajo, pues sí, o sea, lo que tienes que hacer el día a día. Y por otra parte está tu familia. No sabes a qué dar prioridad, ¿no? Entonces, pues, te entras pues en un dilema, porque volvemos a lo mismo, ¿no? O sea, la gente ves que no se cuida, no se protege, no cree, está viendo las situaciones y pues mucha persona se murió por ignorancia.
How is it now that you are returning to normal? Are there permanent modifications?
Pues mira, pues nosotros siempre hemos tenido medidas precautorias para cuestiones de salud, ¿no? O sea, tanto te proteges tú como proteges al paciente, ¿no? Nosotros siempre hemos hecho el lavado de manos, el protegerte de cierta distancia, todo lo que tenemos que hacer antes de tocar a un paciente y después de tocarlo, o sea, todo eso siempre lo hemos hecho. Entonces, pues ahora yo creo que con mayor razón, ¿no? Tanto protección para ti como para el usuario, ¿no? Para el paciente. Y pues no, lamentablemente no. O sea, ya hemos disminuido mucho en cuestiones generales, ¿no? No hablo solo del hospital, sino en cuestiones que ves en la calle a gente que ya no trae cubrebocas, ya no se pone gel, ya no te delimitan a entrar a un lugar cuando está muy concurrido. Ajá. Entonces, eso es por fuera, ¿no? En el hospital, pues nosotros prácticamente lo seguimos haciendo. Los pacientes entran con su cubrebocas, nosotros estamos la mayor parte del turno con cubrebocas, y tratamos igual de no podemos mantener tanta distancia porque siempre tienes que acercarte al paciente. Ajá.
Okay.
Entonces, pues sí, continúa. Con nosotros continúa. En el área de la salud continúa todo.
Do you think we will ever return to the system of before?
Pues yo creo que no, difícilmente. Después de pasar todo esto, yo creo que difícilmente podrías volver a ser como antes, ¿no? Porque yo creo que de alguna manera a todos nos ha modificado en algo en nuestras vidas.
What do you think about the management of the hospitals and the officials who work there?
La organización, pues igual, ¿no? Todo se salió de control, no había recursos materiales, lo poco que llegaba, los insumos que llegaban, ellos se los detenían para ellos, para su familia. Los que estábamos en el área operativa era difícil que te llegaran ese tipo de apoyos, ¿no? De decirlo así. Por ejemplo, tan solo los cubrebocas era algo que nosotros teníamos que conseguirlos para protegernos, porque ellos no nos daban como tal. Ajá. Nos daban uno por día y pues te los tenías que estar cambiando constantemente porque no era así, ¿no? Entonces, veías que ellos traían de los mejores, ¿no? Y dices, bueno, ¿y por qué esto no llega acá con nosotros, ¿no? Esa es una. Los gogles se tenían que reciclar, las caretas, todo eso. Entonces, si tú no los conseguías por fuera, pues qué padre, pero si no, o sea, te tenías que adaptar a eso. Lamentablemente en el sector público, pues pues es así, ¿no? O sea, no tenemos, o sea, pues ese apoyo, ¿no? No sé si en todos los hospitales, yo hablo en el que estuve, en el que estoy, y pues no. Por lo tanto, por todo eso que vives, o sea, pues yo creo que no puedes volver a hacer lo mismo de antes, ¿no?
Sí.
Siempre debes o sea, es lo que te comento, pues tienes que ver por ti, por tu vida, por tu familia, pero pues también está la otra parte de tu trabajo. Y ahí contra eso, pues, ¿qué haces? ¿No?
Sí.
Entonces, bueno, pues eso sería prácticamente algo de la experiencia que yo viví, ¿no? Y
Sí.
que no se manejó bien desde el inicio, ¿no? No sé si por nuestro país, por nuestro gobierno, por nuestro director tal vez del hospital, ¿no? Pero sí fueron muchas situaciones que no.
Okay. Muchas gracias por habernos brindado la entrevista y contarnos un poco sobre tu experiencia.
Gracias a ti también.
Well, it was a very considerable impact in which many human lives were lost, and that even with everything that was done, the measures that we were taking were not able to stop this. Well, the number of cases noted since this was a virus that in each person's it was behaved differently. In some people it presents itself in one way and others in another. So that couldn't be defined because we saw that there were many situations everywhere that got out of control. Well, it was a very considerable impact in which many human lives were lost, and that even with everything that was done, the measures that were taken were not able to stop this. Well, the number of cases, not of the disease, since this was a virus that in each person's, since it always behaved differently. In some people it presents itself in one way and others in another. So that couldn't be defined because we saw that there were many situations everywhere that got out of control. Well, the group of adults of people with disease who had already had conditions such as diabetics, hypertensives, obese. In this group of people, I think they were the most affected. Although there was a number in young people under 30 years of age that was also not achieved, or they do not know why they were attacked, or if they don't have some diseases. So this will, yes or no, it did attack everyone to all population, but specifically in my case, also that as I saw that there were more older adults between 35 and 50 years of age, and more or less, I can tell you. Well, my work, well, I think, well, it was a total lack of control. New disease, I didn't know how to act, how to protect both you and the people, that is. In other words, yes, practically a lot of control. A lack of control. The doctors didn't know how to act. Although we received these updates on how to act, how to protect ourselves to do that, this is to be there. It is a difficult situation, and that you see the people outside I don't know, you don't take care of yourself, you will feel despair because at the moment that you are there, you can no longer do anything. That is because they were already who practically arrived to die. Well, my life, well, we're going back to the same thing. You don't find yourself in a situation where you don't know what to do day by day. And on the other hand, there is your family. You don't know what to be prioritized. So then you get into a dilemma because we're trying to do the same thing, not to give people, you see that they don't take care of themselves, they don't protect themselves, they don't believe, they are seeing the situation, and well, many people died out of ignorance. Well, look, we have always had precautionary measures for health issues. Well, the patient is not there. We have always done hand washing. This is protecting you from a certain distance and everything we have to do before touching a patient and after touching him. That is, we have always done all of that. So this will now I think that with more reason, right? Both protection for you and for the user, right? For the patient. And well, unfortunately, there has not been. We have greatly decreased this in general matters. I'm not only talking about the hospital, but in matters that you see on the street, people who no longer wear face masks, they no longer use antibacterial gel, no longer they limit you to enter this place when it's very crowded, that is outside, not in the hospital, that is outside. Well, we practically continue to do it. The patients with their face mask, we spend most of the shift with this mask and we try to maintain the same. We cannot keep so much distance because you always have to get closer to the patient. But it continues with us. In the health area it continues. I don't think so. I think it would hardly be like before. No, no. I think that in some way all of us have changed in something in our lives about the management that the hospitals and the officials who work there had. Well, there is another very, very intense topic. Organization, well, anyway, everything got out of control. There were no material resources, how little the inputs arrived. They gave them to them. For those of us who were in the operational area, it was difficult for this type of thing to reach you, right? I don't know how to say it that way. For example, only the face masks. The face masks were something that we didn't. We had to get them to protect ourselves because they didn't give us such as they gave us one per day, and well, you had to constantly change it because it wasn't like that, right? Then you saw that they brought some of the best and you said no. And because you don't come here with us, it's one, the goggles had to recycle, the mask, all that. Well, if you get them from outside, well, what's a father? But if not, you had already to adapt to that. Unfortunately, in the public sector, that's the way it is. We don't have that support. I don't know if in all the hospitals, I'm talking about the one that I was in and the one that I'm in, and well, there before no, because all of you that you live, that is, well, I think you cannot do the same thing as before. You always have to do what I'm telling you. Against that, well, that would be practically something of the experience that I lived, right? And I don't know how to handle it well from the beginning. I don't know if it was because of our country or government, maybe because of our director of the hospital, but there were many situations.